Hello everyone, this is Shravanti from Geetanjali College of Pharmacy, currently in the PharmD second year. Today I am here to discuss about the topic inflammatory bowel disease. The objectives are introduction, etiology, pathophysiology, clinical manifestations, diagnosis, treatment, prevention and complications. Inflammatory bowel disease, also called IBD, is an umbrella term for a group of conditions that cause swelling and inflammation of tissues in the digestive tract. The most common types of IBD includes ulcerative colitis and Crohn's disease. Ulcerative colitis. This condition involves inflammation and sores called ulcers along the lining of colon and rectum. Crohn's disease. In this type of IBD, the lining of digestive tract is inflamed. The condition often involves the deeper layers of digestive tract. Crohn's disease most commonly affects the small intestine. However, it also affects the large intestine and uncommonly the upper GI tract. Etiology. The exact cause of IBD remains unknown, but it is believed to complex interplay of genetic predisposition, immune system dysregulation, and potentially environmental or microbial factors. Genetic predisposition. Certain genes like CARD15 are associated with increased risk of IBD, particularly Crohn's disease. Dysregulated immune response. The body immune system mistakenly attacks the gut lining, leading to inflammation. Environmental factors. While not the primary cause, environmental factors like smoking, exposure to certain medications, or the gut microbiome may influence the development of severity of IBD. Microbial influence. The gut microbiome plays a crucial role in maintaining gut health. Dysbiosis or an imbalance in the gut microbiome may contribute to development of IBD. Epithelial barrier integrity. The epithelial barrier which protects the gut from harmful substances may be compromised in IBD, leading in increased risk of inflammation. Pathophysiology. The influx of bacterial components causes the activation of macrophages. The activation of CD4 T cells and helper T cells stimulate other immune cells. CD4 T cells activate cells like B cells, variable T cells, and other inflammatory cells by stimulation of homing receptors on leukocyte and vascular epithelium. It leads to inflammation. This inflammation is maintained by influx of leukocytes from vascular system into site of action of disease. Symptoms. The inflammatory bowel disease symptoms vary depending on how bad the inflammation is and where it occurs. Symptoms may range from mild to severe. A person with IBD is likely to have period of active illness followed by period of remission. Symptoms that are common to both Crohn's disease and ulcerative colitis include diarrhea, belly pain and cramping, blood in stool, loss of appetite, losing weight without trying, feeling extremely tired. The diagnosis. Diagnosing inflammatory bowel disease involves combination of clinical evaluation, laboratory tests, imaging studies, and endoscopic procedures. Medical history and physical examination. A healthcare provider will gather information about the patient symptoms, duration, and family history as well as conduct a physical exam to assess for signs of inflammation. Laboratory test. Blood test. Complete blood count inflammatory markers like CRP, ESR, and stool tests can help rule out infections and assess the severity of inflammation. Imaging tests. X-ray, CT scan, or MRI may use to visualize the bowel and identify structural abnormalities like strictures or fistulas, which are more common in Crohn's disease. Endoscopic procedures. Colonoscopy. This allows for direct visualization of colon and rectum with the ability to take biopsies for histological examination. Upper endoscopy. Used to assess the upper GIT tract, particularly in cases of Crohn's disease where the small intestine may be affected. Video capsule endoscopy. A pill-sized camera is swallowed to provide images of small intestine. Flexible sigmoidoscopy. A shorter, more focused examination of lower colon and rectum. Treatment. The several classes of drugs are used to treat inflammatory bowel disease include aminosalicylates, corticosteroids, immunosuppressant, and biologics. These medications aim to reduce inflammation, induce and maintain remission, and manage symptoms. Aminosalicylates. These are often the first-line treatment for mild to moderate IBD, particularly ulcerative colitis. Examples include mesalamine, sulfasalazine, and olsalazine. They work by reducing inflammation in the lining of intestines. Corticosteroids used to manage moderate to severe IBD, especially when 5-ASAs are not effective, include oral prednisone, prednisolone, intravenous hydrocortisone, methylprednisolone, and topical budesonide formulations. They suppress the immune system and reduce inflammation, but are often used short-term due to potential side effects. Immunosuppressant used for individuals with more severe refractory or corticosteroid-dependent IBD. Examples include azathioprine, 6-mercaptopurine, methotrexate, cyclosporin, and tacrolimus. These medications suppress immune system to reduce inflammation. Biologics, highly specific and powerful medications that target specific part of immune system. Example includes anti-TNF alpha antibodies like infliximab, adalimumab, and vedolizumab. The complications include neuropsychiatric, depression, anxiety, and intestinal colorectal cancer, bowel perforation, bowel obstruction, fistula, strictures, megacolon. Cardiovascular includes heart failure, atrial fibrillation, venous thromboembolism, coronary artery disease, myocardial infarction. The other complications are musculoskeletal, cutaneous, ocular, hepatobiliary, visceral pain. Prevention. These include healthy diet, regular exercise, quit smoking, Mediterranean style diet like rich in fruits, vegetables, healthy fats. This diet may help to reduce IBD risk. Limit dairy. Many with IBD find that reducing dairy intake can improve symptoms like diarrhea and abdominal pain. Exercise. Regular physical activity. Exercise can reduce the inflammation and improve overall health, potentially reducing the risk of IBD. Resistant training. Some research suggests that resistant training may decrease the risk of active disease. Lifestyle factors. Quit smoking. Smoking is a known risk factor for IBD, especially Crohn's disease, so quitting smoking can be beneficial. Minimize antibiotic use. Excessive antibiotic use may increase the risk of IBD, so consult your doctor about appropriate antibiotic use. Stress management. Stress can exacerbate IBD symptoms, so find healthy ways to manage stress like meditation, yoga, exercise, etc. Thank you.